All right, Kevin, you already know it's coming because you're the only person that I've had on here that I actually warned that it's coming.
Yep.
Bottom line question, what does it mean to be a nurse? What's up, guys? Welcome back to Bottom Line Nursing for a new episode. Today, we are with a very special guest, Navy corpsman, surgical technician, and instructor, burn ICU nurse, and my personal favorite, YouTube, Instagram sensation, and honestly, just an all-around good guy, Kevin, the boot nurse Gibson. Excuse me. Kevin, how you doing, sir?
I'm doing good, man. I appreciate you, reaching out and wanting me on the podcast. I always like doing these things. They're fun.
Absolutely. Let's just get right into it, man. Let's just hear a little bit about your background. What you've been doing? How's things go for you?
Well, I guess for all your listeners who don't know who I am, Navy corpsman, been in the Navy for 13 years, 6 months or 7 months. I don't even know anymore. I've been in the Navy for a long time, since breakfast, or not since breakfast, but like people have been telling me that, hey, you've been in the Navy since breakfast. That's first meal of the day, I guess. So been in the Navy for 13 plus years. I am also in the Navy a surgical tech, been a surgical tech 10 of those 13 years as well. I became a surgical tech instructor, went from being a surgical tech instructor to being a TCCC PHTLS instructor, as well as a coordinator for the emergency war surgery course and a trauma nurse care course, or core course, as other people want to call it, to getting my nursing degree, my license as well, and getting my first real nursing experience in a burn ICU for the Institute of Surgical Research, the burn center here in San Antonio.
That is crazy. So you've done like everything under the sun. That's
what
I'm getting at. You've done like all kinds of things.
I don't know about everything, but I always had a master chief tell me back in the day that never do the same thing twice. So I kind of lived by that motto. So I always wanted to try to do different things. It's kind of like diversifying your portfolio when you're buying stocks or whatever the hell. So I try to do different things all the time to make myself versatile and just different things. So the pinnacle for me was definitely getting in the burn center. People that have been nurses and, for a long time have been trying to get in there. And, I networked pretty well in order for me to get over there just to intern. So I thought it was awesome. It's definitely an awesome experience for sure.
That is awesome. And we're definitely going to touch on that a little bit for sure here in a sec. But I wanted to kind of start with just a little bit kind of in that background, the corpsman to nurse thing. I've met a lot of corpsmen. I've met a lot of, Air Force medical technicians, and obviously the med tech corpsman, 68 whiskey in the Army. Transition to nurse is kind of like, we all know, it's one of those things that happens frequently. What was that transition like, and kind of what led you to that process?
I would say specifically for me, it happened like back in like 2012 ish, where I said, man, I really want to be a nurse. Because I had a guy who was my mentor. He ended up becoming a nurse, and before that, he and I were both enlisted, and I told him, what do I need to do? And he was like, you need to go on a deployment, you need to go get some, hoorah, yut, shoot, kill, all that stupid shit.
Oh God.
And shout out to Todd. If he ever listens to this, he knows he's part of my inspiration for wanting to be a nurse. But he told me to go on a deployment. And when that happened, I was like, oh, okay. And then 3 weeks later, I got my chance to go on a deployment, and I did. I was part of a forward surgical team. Probably one of the most rewarding experiences that I've ever had as a corpsman. And it kind of just took off from there. So did my deployment, came back, decided I did, want to pursue nursing. And it's just been a journey ever since. So essentially from 2013 to 2018 has been my nursing journey, from doing my prereqs to doing nursing school, as well as to, graduating, getting my license. Being a corpsman, being around nurses, doctors, PAs, and, the entire medical profession is, it's a unique one. It's kind of like where you grow up in a household and, you end up like your dad, or you end up like your mom. Like you're around these people all the time, every day, all day. and their success kind of just rubs off on you. Be like, man, I want to be like that. Man, I want to be like that. So you kind of just, I guess, walk in their footsteps to kind of find yourself. And that was what it was like for me. I always said that I either wanted to be a doctor or want to be a nurse. And, the nursing kind of just stuck out like for me, like around that point, like in 2012, 2013 time. So the transition from being a corpsman to a nurse is, it's a difficult one, at least for me. They always say that corpsmen are the worst patients, or medical professionals are the worst patients, is because we think we know.
Fact.
And for the most part is like, we do know, but we don't know. It's like, we know the how, but we just don't know the why. And like, we know the how, but we don't understand the maintenance of maintaining a patient, from point A to point B, or maintaining a patient from, from their sickest when they're in the ER to ICU to, to the step down units, or to med surge, or to, to the clinics, to getting them out. And I always said this when I was in nursing school. I was like, I already know how to do this shit. Like, why are you telling me how to do this? And next thing you know, when I'm taking this test, it was a hard reality check to where, oh damn, I guess I don't know how to do this. So for me, it was a hard transition to turning off corpsman to turn on nurse.
I definitely relate and resonate with that. And I've talked on it here before a few times with different guests we've had on about my time in the fire service and, being the emergency medical tech and things like that. The difference is just astronomical. Like you said, we kind of know the how-tos, but finding out that why long-term and, why this, why that, and progressively going on to the unit and caring for that patient for me, I've had patients upward of, 8, 9, 10 days straight, some of them even longer, same unit, same patient. If I don't know the whys behind that process of what's going on, disease processes, why are we doing that? Why are these tubes in, etc., that doesn't resonate too much until we get to that side of the world. And honestly, it screwed me up in school too. 100%. Totally agree.
Oh yeah, for sure.
The EMT brain was like killing me on exams, mainly, like 100%. I remember telling my instructor, I'm like, what in the heck am I doing wrong? She's like, are you thinking like real world? And I'm like, yeah. She's like, well, there's your problem. You got to think like a test. And I'm like, well, that's kind of difficult, and
it's real difficult for you to tell me to do. It's kind of like, you can't teach an old dog new tricks.
Right.
So it's just like, how are you going to tell me like what this is and what's going on when I have personally seen it, and this is how it really happens, versus I go to a book and the book is just like, hey, it's systematically, this is how it goes, and you're like, that's not right. But you have to turn your brain off. I remember an example where I'm a surgical tech, so I understand sterilization processes, I understand temperatures, I understand microorganisms, how to kill them, X, Y, and Z. We learn it all in school as a surg tech, and I taught it a lot when I was an instructor. So when I had a Zoom meeting, so to speak, with our instructor for fundamentals, she was telling me how to put on sterile gloves, and I watched her do it, and I was just like, excuse me, that's wrong. And she was just like, it's not wrong. And I was just like, it is wrong because X, Y, and Z. And I started laying out, what the AORN states, because AORN governs search text. I was like, hey, this is what it says, or NBS TSA, these other entities that tell you how the disease process, the sterilization process, how to put on gloves, all that good stuff, right? And so she didn't kind of like me after that, but
I bet not.
But then I understood the whole point is the way that she was explaining it. It was based off of, nursing, not as a surge tech. And so I had to turn corpsman and surge tech off when it came to specific things in order for me to, really grasp nursing. So I guess the whole, being a surgical tech and then an instructor and then being a nursing student all at the same time, it was a lot of give and take, a lot of giving up and taking what nursing was given to me.
Absolutely. So what I'm getting out of that is you and Foley practice during nursing school didn't go well together.
Oh no, man. Like,
That's
well,
what
I mean,
I'm getting from
Foley's,
that.
no, hey, look, don't get me wrong. Like the Foley practice was easy for me because like when I was at my my last command, when I was in Jacksonville, I used to work in C-section all the time.
Yeah.
And so I would do the prep for the patient. I would do Foley's. Some of the nurses didn't want to do Foley's or didn't know how to do the preps. And I was like, I got you. And so like for me to do Foley preps, it was easy. And then the instructors were just like, have you done this before? I'm just like, yeah, I'm a search tech in the Navy. And they're just like, oh, well, that explains it. And then they would leave me alone.
I'm like, oh yeah, I got my sterile field perfect. Watch this. How about that?
Facts.
Yeah, I can imagine you were the one being, all the girls were like, how do you do this?
Yeah, like pretty much people flocked to me. They were just like, well, I'm going to stand next to the corpsman tech because he knows what he's doing. I'm like,
Nope, hard no. Yeah, people came to me about this, that, and the other, and I'm like, oh no, don't come over here. I don't do that out in the real world.
I'm like, yeah, you want to fail? Because I'm about to fail. We're both going to fail together, but that's okay.
Well, it's a good thing all the tests were locked because, I told people, I'm like, don't be looking at mine. You're going to fail, bro.
Yeah, for real.
But dude, that is so cool. I think that, that resonates, I think, with a lot of people coming from the backgrounds you and I come from, both civilian and military. And for anyone thinking, about this or listening, the EMT fireside and, any of the medical jobs on the civilian side that, translate going to nursing, it's a hard task. It definitely, your brain has to change it up a little bit when it comes to that practical piece versus that this is how you do it in school. But then you get out of nursing school and you become a new grad, right? And you're like, well, this is what they told me in school. And everyone's like, that's not quite how that goes. This is the real world again. So here's how we do this.
It's like you go from real world to perfect world back to real world. But perfect world is stuck in your brain because of how they brainwashed you in school. And then you go back to perfect world and you're just like, damn, I forgot everything I knew before I knew nursing school or before I did nursing school. And now here I am again, starting all over. However, I don't want people to think that everything that you learned as a paramedic or an EMT or everything you learned as a tech or everything you learned as a medical assistant, CNA or whatever, I don't want people to think that those things are not beneficial because they 100% are. Because
absolutely.
It helps you with your hands-on skills, because I know a lot of nurses that I went to school with that were fantastic at taking tests, but when it came to touching a patient, it was like they were having a stroke, like they were having like 1,000-yard stare. They didn't know how to do anything. I'm just like, hey, put your gloves on. They're like, these gloves? Yeah, put those damn gloves on. Like, what are you doing?
Cover your hands up, bro.
Right. So they were like, what do I do with my hands? Ricky Bobby style.
I'm not sure what to do with my hands.
Be good just to hold them down by your side. Yeah, great.
Yeah.
What do I do with them? So, but those things I want people to realize is that those skills that you acquire, doing those jobs are going to help you out tremendously. It's just understanding nursing as a profession and our role.
Absolutely. And I think you and I talked about it at one point from a previous guest we had on the show with us talking about med techs and the nurse relationship. It's that practicality versus that, book smarts. It's that street smart versus that, oh, I can go sit and read a textbook all day and absorb every piece of knowledge and regurgitate, which, don't get me wrong, has its place. Yeah. But you got to have a good balance. And I think you're right. Definitely the backgrounds that a lot of people have coming into nursing school with that practical piece definitely made it a little easier when it came to the hands-on. Like, I was all about the hands-on, put a test in front of me. Yeah, no. Go put me in the, the hospital in the clinical setting. I'm like, let's go do something cool. Let's go learn something new today. But that's awesome. So we kind of went into that becoming the new grad out of school. And I think technically, are you still considered a new grad? I can't remember where we're at this point as far as years on with you.
I mean, I guess what is the definition of a new grad? Is it like less than 6 months? Is it less than a year? Is it, a year out of school? Is it like a practicing timeline? To me, I don't know.
Question. No clue.
I don't know. I have no idea at this point. I graduated in 2018.
Right.
I didn't get my license until, June of 2020. Mm-hmm. I never touched a patient until January of 2021. I have no idea. I have no idea where I fall in regards to new grad, novice, damn sure not a veteran, because I'm looking at it like, whoa, okay. And even if you are a veteran, it's like you're going to continuously learn all day, all the time.
Every day. Like real talk. Every day.
Yeah.
Just last night at work, all the time. But okay, so that's kind of funny.
Yeah, it's crazy.
So your new grad job, quote unquote, you got out of school, got your license, first nurse job, and you're at a burn ICU.
Yeah, so it's kind of crazy how that worked out. So just to give people a little bit of a backstory of how I ended up here, and how anytime a door closes, another door will open. Either it be good or it be bad. So for everybody that doesn't know, I took my NCLEX 4 times. So the first time I took it was right out of school.
Ow.
How?
I said, ow.
Ow. Oh yeah. Look, let me tell you something. You know what really hurts? It's not really my brain, it's my pockets, because
exactly
all of the study material I had to buy, out of, all of the time that I had to dedicate. It was definitely a headache. It was definitely, hard, but 100% doable if dedicated, and if you have the right time, and if you have the right space to make it happen. So I don't want to harp on it too much, but failed my NCLEX 3 times. I passed it on the 4th. There was a lot of things I had to learn about myself as well as my environment, change that up, and then I was able to be successful June of 2020. What made that very unique for me is that I coordinated a course called what is it called? It's ABLS, which is Advanced Burn Life Support. I coordinated one of those classes, and I was also an instructor for one of those classes. And I knew the nurse educator who works at a specific hospital. And I asked her once I got my license, because she knew my struggle of what I was going through. I was just like, hey, so I'm trying to apply for this internship program. And for those that don't know, the military, each branch, I believe, as well as the Department of Defense, has a program called the Career Skill Bridge program, which will allow for you to do an internship anywhere. It doesn't necessarily have to be about nursing. If you want to go be a manager at McDonald's, hey, shout out to McDonald's, because hey, look, French fries are still the shit. So, but if you want to go do an internship anywhere, you can, as long as you're 180 days out from when you're supposed to transfer out of the military or retire. So I knew that I was coming up on my 6-month mark. So I asked her, I was like, is it possible that I could do an internship in the burn center? And the burn center consists of research, the burn clinic, the burn operating room, the burn ICU, as well as the burn step down unit. And she was just like, oh yeah, absolutely. And she said it with no hesitation, because she had already known who I was. I had already networked with her a lot, and she's a super sweet woman, to where she, all she wanted to do was just see me succeed. And I asked a lot of people about it. I was like, what do you guys think about me, interning in the burn center? They said, if you can intern in the burn center and you can make a good impression, there was like, that is gold on paper. And I was like, okay, so let me try it. And I'm always down for a challenge. And I think my biggest concern was that I didn't want to let other people down, and I didn't want to embarrass myself. But in the burn center, like, those nurses that work there are like the cream of the crop. Like, in order for you to even work in the burn ICU, you have to already at least have 3 to 5 years of ICU experience before they even, let you work there. And so for me, I put in the application, I contacted the people I needed to contact. And as soon as the ball got rolling, they were just like, we need to get you here. Like, you only have a certain amount of time left, so we need to get you here. And I started in the burn ICU at the end of January of 2021.
That's crazy. Brand new, brand new going in. Like you said, most places, especially the burn ICU, isn't going to hire people 3 to 5 years ICU time prior to coming to a burn ICU. And right. You just got this awesome opportunity. And how you got it is even more amazing. It says a lot about you. You know, how your skill is, how your character is, how your ability to, speak with others and what they thought of you, in my opinion, which doesn't surprise me at all, by the way.
Oh,
but
stop.
that's freaking awesome, dude. Like, I know we've talked about a little bit of it, and you just got done with your internship not too long ago. I think last week. That's freaking awesome. Do you think, as a quote new grad, first nursing job, we'll go with that as the baseline of new grad, first nursing job, do you think it was doable to be in the burn ICU for somebody without previous ICU experience, just in general, for anyone who's ever thought about it?
I would say that as a brand new grad, to work in a burn ICU, which is the highest level of acuity that you would ever see in a patient, because there are so many things that are happening with that patient at the same, all of these things are happening at the same time. So as a brand new grad, your chances of getting in there are slim to none, as well as it would not necessarily be a great fit for you because of the lack of the basic core nursing abilities. So we'll say, I'll give you a couple of examples. We'll say the Alaris pumps. So everybody knows what the Alaris pumps are. If you don't know, those are the pumps that, you put your IVs in, that you put your lines in for your IV bags and all that good stuff. And they do your drips and all that good stuff. I had never touched an Alaris pump. And so I'm getting told, hey, we need to do these insulin drips. We need to do these pressors. We need to get, these cardiac meds. We need to get everything in here. And I'm just like, oh, okay, cool. The first room I ever walked into, this guy had like 8 drips going. And I'm like, oh, well, this is gonna be fun. And I was over here trying to figure out how to, change the pumps. And I had no idea how to work the pumps. And my biggest thing is, at least for me personally, is creating a medication error. And I don't want to increase it to cause any issue, but I don't want to decrease it to where it causes an issue. So, like learning how to do the pumps, your nursing diagnosis, understanding the disease process that's going on, which disease process needs to be a priority, your nursing assessment, which is the most important, getting in the room, touching your patient, assessing their breathing, having the confidence to say what is going on and having the confidence to say that you don't know what's going on. And that's okay. I've always been one of those people who's been super honest. I was like, I don't know. I give you the good old ensign, butter bar, HR, freaking PFC, Airman Basic salute by shrugging my shoulders. I have no idea what's going on. And a lot of my preceptors, they understood that. They were like, what experience do you have? And I was like, as a nurse, none. And they were like, oh, okay. So they were just like, so we got to get you from the beginning. And I had to hit the ground running. So it's like starting a race, but you coming in when they're already 3/4 of the way done and trying to catch up. And that's how you feel. And so as a new grad, to start in the burn ICU, I, for most, would not recommend it. However, what I would recommend is going to where you want to go. So if you want to be a critical care nurse, go to an ICU residency program, or go straight to the ICU, a medical surgical ICU, however long their orientation is, whatever. If you want to go to med surg, go there. If you want to go to dialysis, go there. Telemetry, go there. ER, go there. The great thing about nursing is that you don't have to go to med surg. You don't have to do it. You can go anywhere you want as a nurse to jumpstart your career. For me, I knew right off jump that I wanted to do ICU. The fact that I got the burn ICU, and it's already set a standard for me of where I know I want to be. So as a new grad, to get to the burn ICU, to reiterate, no. But if you want to go to the ICU, go do it. Don't let no crusty ass nurse in nursing school tell you that you can't go anywhere as a nurse.
That's good talk. I think that's awesome, because I've been in a burn ICU, just checking it out, and got to go spend some time out there, just, as a student, hung out with some awesome nurses. mind was blown 6 ways sideways. I was like, holy hell, what is going on up in here? And obviously coming from the fire department world, burns, big thing we train on, we encounter, we deal with. And it's one of those things that we all know, it's knock on wood, it's never a matter of if as much as it is when. I never want to go back to a burn ICU, to be quite honest. I envy and love and am very, very envious and thankful to nurses and staff that can work burn ICU. I just know that me, especially in my head, not so much. Hard no. I feel like the skill set, like you said, definitely, like you said, with time and, just knowing I don't know is okay, but I'll learn. I can absolutely learn as long as someone's willing to teach me. I think anybody can do that. And just like you said, go into the ICU fresh out of school, go do a residency. Don't let anyone, tell you no about that. And I completely agree and resonate that. For everybody listening, though, I will throw one just caveat to the you don't have to go to med surg thing first. Not that there's anything wrong with that. I currently work on a med surg unit, as everybody knows. Depending on what service branch you come into, if you're a brand new grad fresh out of school, you're going to med surg or OB. Sorry guys, just throwing that out there. I will say this, I've gotten some of my best critical thinking, time management, skills thinking. 100% I've definitely upped my game in that department working on a med surg unit, because you run 6 excess patients at a time. Just the acuity level is far, far different.
Absolutely.
So I think that's great to hear that you got that opportunity, man. And, especially fresh out of the gate, you're like, burn ICU, challenge accepted. Why not?
Right.
I think that's awesome.
I kind of want to reiterate 2 things. I don't want people to think that, hey, like I said, going to med surg is just like, oh, it's not about me, or it's not my thing. The great thing about med surg is that the one thing you said was time management, and that is absolutely time management as a nurse is the pinnacle of what you do, because you could have 6 patients and their acuities could be lower, or you could have 2 patients where they have very high acuities. I remember for one of my patients that we had, he was 54% burned, and we were in his room for 3 hours.
Yep.
3. And that was one patient, 3 hours, versus if you had 6 patients, you're going to go in there and be in there anywhere from, 5 minutes for whatever question that they have, if they're ringing the call bell, to if they're coding. So, who knows how long that could be. But the greatest thing about time management is that you're going to get time management in any service, I should say, that you work in when it comes to nursing. So whether it be ICU, whether it be ER, whether it be OBGYN, like you're going to have that time management. So I don't want people to, it's not to talk bad about med surg, but it's just like med surg is not for everybody. And that's just to let you know, you can go anywhere. And the great thing, like I said, about working in the ICU, especially the burn ICU, is that you learn how to cluster care. And that was something that I learned super fast, because like I said, I had a patient who was 54% burned, who I was with my preceptor and other people. And we had to go in there, do the assessment, anything from checking residuals to checking his pupils to cap refill, neuro, all that good stuff. But then, we have to do wound care, and wound care on a burn patient is a very meticulous task that has to be done, because sometimes you're by yourself. Sometimes you could have 3 or 4 people in there, and then you're taking them to a shower. The shower can get upwards to 95 degrees. The rooms can get upwards to 95 to 100 degrees, and you're in there for hours. So, and so the time management is about getting it done in a timely and an efficient manner, to where, you're doing the wound care, as well as you're hitting all the objectives you need to hit to make sure that the patient is okay, because, your barrier to protect yourself is now gone, for infections and stuff like that. So the time management is pertinent. And I can't even tell you a day to where I had to change my scrubs like 3 or 4 times a day because I was sweating so much.
Dang. Like, that's crazy. A lot of people don't think about that.
No.
I appreciate you kind of throwing that on me to kind of caveat a little bit. That's just, wow. Whew. 3 to 4 times a day you're changing your scrubs. I couldn't imagine that. I mean, I already running around on the floor sometimes and I'm like, oh crap, it's hot up in here. But that BCICU, you got all kinds of stuff going on now. Heat's turned up. You're wearing all kinds of PPE, all kinds of stuff, et cetera, et cetera. Dude, I don't know how you do it. I envious of that because that's
like I
crazy.
said, man. Like I said, it does take a special person, to want to work there. The preceptors, all the nurses, like I said, that were there. Some have been working there like 9 years. There's a few of them that have worked there like 20 plus years, who are just like they're just like, they're like the subject matter experts, like for everything. The nurse manager, I believe she's been an ICU nurse for like 15 years. And she's probably one of the best leaders that I've ever heard talk, as well as the assistant OIC as well, who was an Army captain. He was phenomenal. Like, everybody there empowers other people to do better, and as to make life easier on the nurses, as well as helping each other out. That is the burn center as the epitome of teamwork that I have ever seen. Like, I can't even tell you how many times I was in a room and I got to the point to where I was by myself and my preceptor was just like, hey, you got it? And I'm just like, I got it. And he was like, well, if you need me, Vocera. I don't know. I don't know if y'all got Vocera, but Vocera,
nope,
first off, let me tell y'all, hey, if y'all got Vocera, she don't be listening. She be calling random folks, and I'm like, she's like, did you mean so-and-so? No, Vocera, I didn't. So I'm gonna need for you to get it right. So I would leave, or my preceptor would go and he would do something else. And he like, if you need me, call me on Vocera. And then I wouldn't need him for like a whole day, or he'll pop in, hey, are you good? Or if we were doing wound care, other people would pop in who weren't on, who didn't actively have a patient. They would be like, or on first admit, hey, are you guys good? Hey, I got meds for you. Hey, you guys doing wound care? Hey, you guys are going to go first to the shower. Hey, I'm going to help you. Hey, I got your tray ready. Hey, I got this. Hey, I got that. So everybody worked efficiently as a team to get those heavy hitting tasks done as soon as possible. That way we could, manage the patient for the rest of the day, because then after like, a certain time of the day, then visiting hours come and you don't want to have to do dressing changes, take them to the shower or anything like that, when the family is coming to see them.
For sure. That's awesome to hear. And I'll use the cheesy blue, DOD green, whatever phrase, however you want to call it, cheesiness of teamwork makes the dream work, right?
Oh, Lord.
I mean, but it does though.
Man.
You know it.
All right. Hey, it really does though. I'm not.
I mean, come on. You were jabbing at butter bars earlier. I think we can
You're
go
right.
down that road.
You're right. You're right. Hey, teamwork makes the dream work.
I mean, but it's cool though, because like on the real, if y'all weren't doing that, all of y'all's day is going to get jacked up. Yeah. And patient care is going to be all kinds of crazy, and it's going to be a traffic jam at the shower.
Yeah.
It just, like you said, task management, time management, prioritization, kind of just getting those things done. But I really like what you kind of talked on a little bit, of course, with backing to your instructor background, talking about some of the awesome preceptors you had that were hooking you up. And then you talked about some of the nurse managers. So kind of that education piece and educating others. Let's talk a bit about you in educating others, sir. Instructor, surgical technician instructor, multiple different courses of nursing, pre-hospital care, multiple different things right there. And then my personal favorite is the YouTube side, where you're just educating the world. Talk to me a little bit about you in that realm.
Okay. So I always told myself that I was like, man, I'm not going to be nobody's damn instructor. I ain't teaching nobody.
Yeah, joke's on
ain't
you.
nobody trying to do all that. Right. So once again, I go back to, my deployment, where I, as a surgical tech, I was one of 2 or one of 3. I think I was one of 3. And, we were teaching foreign nationals how to, kind of perform our job if we needed help. And, like to do certain things, it was kind of universal. I would point, I'd be like, pass, and then they would pass it or something along those lines. Right. So I always said to myself, I was like, man, like, you know what, I wouldn't mind. After that, I was like, I wouldn't mind being an instructor. And I get back to my command and I get promoted. And I was like, oh man, they have an opening in San Antonio to go be an instructor. I want it. And it's funny because the detailer, which is, for people that don't know, in the Navy, we have a detailer who places people in specific jobs. He used to be my LPO. My LPO used to be my supervisor for the OR. And I called him and I was just like, hey, what's going on? And he was like, what's up, man? I was like, hey, I'm trying to be an instructor. And he is just like, okay. And then he gave it to me. So I got the instructor first time and went there. I was, like I said, the search tech instructor. It was phenomenal. I learned so much. My biggest thing is giving back to the younger generation of corpsmen / surge techs, not just about, military side, but just, being, a person and how to navigate your way through the Navy and through the military. You can make the career work for you. You don't have to make it work for you. You can do your time and get out, whatever, it could be a stepping stone for you. Fast forward to nursing. Like I said, I failed my NCLEX 3 times and I passed on the 4th. And I said to myself, when I pass my NCLEX, I am going to start a YouTube channel so I can tell people my story and my journey, because I don't want people to ever feel how I felt when I was failing my exam. I did well when I was in school. And shout out to all of my classmates, especially my girls from Houston. They know who they are if they ever listen to this. But like, if it wasn't for them, they would we wouldn't be able to, I wouldn't be here sitting talking to you. So I always said that I would never want people to feel how I felt, like you felt like you're a failure, or you feel like, you're behind the curve, or you feel like that you can't amount to being a nurse, or you sit there and you think to yourself in your head, like, man, maybe that crusty ass nurse in nursing school was right and nursing isn't for me, which is really crazy because, who are they to judge on, who or what the fuck you want to be? So when I created the YouTube channel, I was crazy nervous about it. And, I just did my intro about it. And then I think my first big video was the Kaplan review, because that's what I used that helped me pass my NCLEX. And, there's a whole bunch of other reviews out there, like I used UWorld, I used Board Vitals, I used the Saunders NCLEX book, I use Hearst, I use Mark Klimick. There's an NBSTSA, there's a NCSBN.org, there's Nurse Achieve, Remar Nursing, Registered Nurse RN. Hey, real quick, let's talk about Registered Nurse RN. Nurse Sarah, if you ever hear this, I'm not going to give you my tuition money because I ain't got it no more, but you helped me get through nursing school. So, hey, shout out to you. Yeah, so that's the biggest reason, man. Like, that's the reason why I did it. It's because I want to encourage others to realize that they can get through this. If I can fail, this exam, I'm not even going to say fail. If I'm unsuccessful at passing this exam, I can be successful at passing this exam to go on to being a successful nurse.
That's probably one of the most humble answers from an individual I've had to a question like this since I've been doing this. So thank you. Real talk.
Yeah, man.
Because for everyone who's listening, everything we're talking about, as you all know, I've always said it, this is not just military talk. This is nursing in general. This is nursing civilian side, military side. Doesn't matter, you name it. We can talk about this in general context all day long. This is one of those moments to pay attention to it. What Kevin's talking about is one of the most on point things when it comes to, we wouldn't be nurses today, myself included, without other people that have been nurses for God knows how long, some of them longer than we've all been alive combined, teaching us and showing us how to get there and saying, you're not going to fail, you're going to get there, you're going to do it. And the only reason we're here is because they passed it forward to us. And now it's our turn to do it to them, right? if we're not building up those other people so that they don't feel the way we felt, like you said, having, 4 times on the NCLEX is a rough road for anybody, man. I don't care who you are. Holy
Yeah, for
crap.
sure.
Just
Man,
throwing that out there.
I've met people who
I mean,
have
that's crazy.
I've met people who have taken it like 9 or 10 times.
Yeah.
And to me, I'm
that's
like,
crazy.
wow, that is crazy.
And it's no jab at anyone, at the end of the day, you passed the same board I did, and that's all that freaking matters. But you said it, you had people and mentors, and sidebar to another conversation Kevin and I had at one point, he had 2 mentors, if I recall correctly. One of them gave him a nice answer to what was going on with passing his NCLEX, and the other one said, well, what the hell are you doing wrong, if I'm not mistaken, or something to that effect.
Yeah,
a certain male mentor you mentioned to me.
Hey, shout out to Jason. Shout out to Jason for telling me like it is. I
had to throw that in there.
Appreciate him. Yeah, for sure.
But again, even with that kind of love, guys, if you're not showing those that are coming after you the way, the path, the way, or whatever the hell you want to call it, to get where they want to be and to make them better and to grow them and to get them into this profession, if this is what they want, you're doing it wrong. Because we wouldn't be here, you wouldn't be there, no nurse I don't think would be there without somebody, whether it was a nurse mentor or a family member, a spouse, whatever have you, showing you and giving you that give back, right? And the fact that now you're educating the world, literally, YouTube, awesomeness. Go check out his channel, by the way, shameless plug until we get there. Some awesomeness going on, because he's right. I don't want people, and that's one of the reasons I thought about doing this show is, I think there's a knowledge gap. I think there's information missing along the way for nurses. We're trying to fill that gap. We say it in the service too. You're building your replacement for when you retire. Yeah.
Hey, I like the fact that you said that. Is I always used to say to my students, back in the day, and if any of them listen to this, they know that I appreciate them, every single one of them, even the ones I kicked out of the program.
Hey,
I used to tell them during the intro, I was just like, the whole goal of you being here is for you to replace me. So like, if I withhold information from you, I am doing you a disservice, because everybody holds information so high, to like, now you're like, hey, you got to pay for it. And don't get me wrong, it's just like, you don't pay for information, you pay for other people's time, for civilian type deals, right, or whatever. But sure. But the information is out there. And if I can't give you my experience and where I went wrong, and if you can't learn from my experience, or if I don't teach you the wrongs that I did, like, I'm doing you a disservice, not just as a search tech or as a nurse or just as a person. And that's not the way that I ever seen myself. Some people used to tell me, man, you're telling people too much. I was like, it costs me nothing to tell you what not to do. As well as, it does cost me money to tell you what to do. I had an individual at one point in time, and this has nothing to do with nursing, but I asked him about stocks because he was super successful. And his exact answer to me was, nah, I can't help you. He was just like, I figured it out on my own, so you're going to have to figure it out on your own. So at that moment, I realized what type of person I was dealing with, and I never wanted to deal with that person again. And I don't deal with that person anymore, because it's just like, you could have very easily said, hey, I use this app, or I go to this website, or I do this, look at these top 3 things, read these articles, or X, Y, and Z. And I would have been like, all right, cool. Now I have a starting point. Now I can learn, because I have that whole thing, see one, do one, teach one. Because if you told me what to look for, and if I went there and I looked for it and I learned, and then, a week or 3 weeks or however long later, somebody else asked me about, stocks, I'm gonna be like, hey, I don't know everything, but this is where I got told to start. And I thought it was pretty helpful information. So you're passing that information on to somebody else. And so from that one example, I learned, and that was a long time ago. From that one example, I learned that, try to help those people out, because you never know how well the information will benefit them, and then come full circle and then benefit you. I used to have an instructor. He was just like, I want to build the relationship as an instructor, but pass you enough information to where if I ever had a flat tire on the side of the road, you would stop and help me.
I like it.
And so it's just like, I can't even tell you how many people have reached out to me and have asked me questions or tell me how proud they are of me for, telling people the journey or helping people, figure out something for themselves, or even just encouraging them because, I have a video where it said I failed the NCLEX. And they appreciate that because at some point they feel like they're not going to be able to do it. And I'm just like, nah, man, like you just need the proper encouragement and to let you know that it's okay that you didn't pass that exam. I was like, because guess what? You could take it again.
I mean, really, you can. Proof's in the pudding. But
right?
Like you said, your checkbook's going to hurt, but
that's okay.
But at the end of it, that's a small investment for a long-term gain. So
that's it. I'm all about people. I'm all about people's journeys because everybody's journey, everybody's book is going to be written different. So when you invest in yourself, the proper way, when it comes to time, accountability, time management, what you're doing, what you're not doing, so on and so forth, it was just like, you're going to be the winner in the end on, being successful, not just in, the NCLEX and nursing, but in anything.
Right. I mean, I think you said that example really didn't, absolutely nothing related to nursing, stocks, but the concept of it though, at its core and the lesson there, I think 100% nursing. I have people ask me sometimes about, hey sir, hey LT, or, hey Nick, whatever. How do you do this? And I'm like, well, I'm not 100% sure, but I sure as hell know where to find the answer. So we're going to go find the answer together. And now we're both going to learn it. Watch this. Sure. Or, I ask, our technicians if there's something, hey, I haven't had to do this. This hasn't come up lately. I just haven't had to do it. I don't see everything. I'm one human. I'm one nurse. I don't have 40 billion patients. Boy, that would suck. Right. But I'm like, if you've seen this, cool, show me how to do this, and vice versa. I love doing that. And, hell, just the other day, you and I were talking and knowledge exchanging hardcore about some stuff, right?
Yeah.
All day long, I'm not doing the YouTube thing. You were throwing some bombs of knowledge on, hey, this is where I learned how to do that, and already checking it out because it's like, it's perfect, and that's how it should be. That's how it should be in nursing. That's how it should be in life. I don't see any reason, and we won't go down the rabbit hole of that individual that you encountered with that stock stuff, but no, those ain't the people you want to go near. That's all. I agree 100%.
Yeah.
That ain't the person that anyone should be. And, to all the nurses, aspiring nurses, preceptors, especially, talking about educating others, don't be that guy. 100%. Sure. Don't be that guy. Yeah, that's just not how you roll. Just because I taught myself how to do it and I'm going to say, oh, you got to go teach yourself. No, hard no. That's just not how that rolls. But dude, that is freaking awesome. Educating the world. And you kind of, I know that leads us into another big thing is, with all this going on, what are the future plans, dude?
The future plans.
What are you going to do when you grow up?
Man, look, okay. I don't even know how. First off, adulthood is the worst hood I've ever been in. It's just a lot of things going on. I'm actually the last 9 months have been an extremely huge transitional period for me. I won't go into detail about it. I might make a video about it. Hint, hint. But
no shame.
No shameless plug on that one. But I am currently transitioning off of active duty into the Navy Reserves. And a lot of people are going to ask me, oh my God, why? You did 13 years, just spend 7 years. But hey, shut up. All right. So there's one thing that I'm going to tell everybody is that a lot of things I can replace or you can replace, but time is not one of them. And when it comes to doing something that you want to do, and if you are strong and passionate about it, do it. So if you did 6 years in the Navy or 5 years in the Army or whoever else, and then you found your purpose and you don't want the military anymore, leave. You are not required to stay at all, no matter how much senior enlisted is trying to retain you. I don't care. So my biggest thing is I am leaving active duty because I want to work as a nurse in the civilian side. And now, before anybody asks me, oh my God, Kevin, why haven't you done an officer program? Right.
Oh,
so
geez.
I wish y'all could see my face as I said that. Right. So
Yeah, pretty much.
so another, crazy thing that happened to me is that I applied for multiple officer programs before nursing school and while I was in nursing school. And I did not get picked for any of them. So I'll give you an example. In the Navy, we have this program called MECEP, or the Medical Enlisted Commissioning Program, which will allow anybody that's enlisted in the Army, in the Navy and the Marine Corps to commission as a nurse if you get selected for this program. I applied for it before I started nursing school. Then I applied for it again in nursing school, and I didn't get picked for any one of them. I applied for the nurse candidate program through the Navy recruiter, didn't get picked for that one. And I think that was it. Then I also got told that, hey, you can do it. You can join the Army. So about the Army. Next question. So let me stop. No, the Army is not my calling. Army is not for me. This isn't to, in the services, we kind of rag on one another, and, we go back and forth about which service is better, X, Y, and Z. Everybody's mission is different. But the Army is not my mission. Kevin Gibson's, it is not. Sorry. But that could change later in years. But I decided that, once I got my license, it was solidified at that point to where I'm going to get out to where I can focus solely on doing nursing and not have to worry about, military responsibilities, military tasks that are given to you, deployments, or possible deployments. And don't get me wrong, I'm always about going to go get some, but at this moment, it is, I want to focus on being the best nurse that I can by absorbing all nursing. And then at some point, I could come back, active duty if I decide I want to do that, but I still have my foot in the door with the Navy Reserves. So, I'm still able to, keep some benefits. I can go, be a weekend warrior, as they call it. And,
I might say that a lot.
Right. And then, I still do myself a really good service. I still, give service to my country, which I absolutely love doing. And to those people that join the military, you guys have my utmost respect, because nobody asked you to be here. You rose your hand voluntarily to be here. If you didn't want to be here, you wouldn't have. So, I know it sounds corny when people say thank you for your service, but I appreciate those people. Because you're less or around less than 1% of the American population to step up for that calling. And I know that we just had Memorial Day, so I appreciate all those people who are active, and I pay a mad respect to our fallen brothers and sisters who didn't get to come home for to see their families or to live a normal life. So so that's my future plans as of right now. I get off of active duty here during the summer, and then I will, start, in an ICU job, taking the experience that I had in the burn center and, pushing that forward. And then me and the nurse manager actually had a long conversation, but she told me flat out, she's like, I want you to go somewhere else and get different nursing experiences from different places, because I want you to see how different it is from the burn center. Because in the burn center, you can get spoiled,
right?
Because you can have the people. Sometimes you can, sometimes you can't. But you could go somewhere else and it could just be you and 2 patients, in an ICU, or you could be in a cardiac unit, or you could be in med surg with 8 patients. There were some hospitals around here I'm not going to name. You have like 10 patients on a med surg unit. I'm just like, excuse me, that ain't even safe.
Welcome to my world.
Right. Right. So, shout out, like I said, to the nurse manager. She really did take me under her wing with mentorship, and, where to see myself in the next 5 years. And if I'm not active duty by that time, y'all are gonna see me in the burn unit again.
I mean, there's nothing wrong with that, dude. And you didn't mention it, so I apologize if I'm bringing something up that I shouldn't be. But I have a passion for this particular area of nursing too. And if I'm not mistaken, it's kind of your end game. Flight nurse, maybe eventually, right? No,
good old flight nurse.
Maybe is that what I heard?
Yes.
Little Bodie over there told me once.
So, if you guys don't know who our good old buddy Jack Crowley, a shout out to him first off, because that dude is just look. All right, me and him go way back, Cuba days. If you guys ever have a conversation with him, he'll tell you. But the end goal is CRNA. And no, It's not because of the money, because a lot of people are just like, man, they make a lot of money. The money is a huge perk. However, it is a knowledge that I'm about. And I always used to say to people, like, if you do what you're supposed to do, the money will come. So like I have a different relationship with money right now. To where I think about that, and I'm just like, I'm not really necessarily worried about money, because I know where I put myself and I set myself up, I'm going to be totally fine. But I've always wanted to do flight nursing. I got a little bit of that experience when I was on my last deployment, and loved every bit of it, to the point where I was like, when I become a nurse, I want to do flight. And I've been looking that up. And I know a lot of flight places want you to have ICU experience. They want you to be certified in critical care, or, as a ER nurse or a flight nurse, as well as, having those other courses under your belt like TNCC, PHTLS, and a lot of states, like you were telling me, they want you to also have your paramedic. In Texas, I'm not sure, man, because I was doing a little bit more research, but end game is CRNA.
Okay.
The in between is flight, because I'm kind of an adrenaline junkie. I would have never guessed. I'm saying, right? I'm kind of an adrenaline junkie. I want to be in a helicopter. I want to fly. I want to do stuff like that. But the other huge things that come with that is the level of independence and responsibility that you have. Because if you are in a helicopter by yourself and you are making calls to save somebody's life, you are on a great level for you to succeed at a doctoral level when it comes to doing CRNA. So I feel like going to that stepping stone of that, me personally, not other people, but for me personally, will set me up to be able to be super successful when I get to that doctorate level.
I think that's definitely true. And again, I couldn't resist but to bring it up, because I knew where it was going to go, and I wanted people to hear that, that's kind of the progression you're looking at. I know I just throwing it out. But you're right. I definitely agree. CRNA is a great end goal, dude. I just know for me, it's way above my head. And it probably
he says that now. He says that now until he starts going paramedic. He's para nurse over here. Well, there's actually a para nurse and
that's the thing, dude.
I just like, if you're trying he says that now until he's flying, intubating, RSI and folks, and next he's like, I want to do anesthesia. And then next I'm gonna see him. We're probably gonna be in the same damn class together. Who knows?
We probably would be. I mean, honestly, so to everyone listening, I'm just gonna drop some hints real quick, and forgive me, Kevin, we just gotta throw this out there based on the jabs you're taking here. One, you could come blue. I'm just saying, you didn't bring up the blue, but hear me out. Here's why. Because don't get me wrong, I have nothing against any of the services. I know nurses and members of all of them. I've worked and served with all of them in medical and not medical, enlisted and officer, and we all love each other. It's like a sibling rivalry all day long. However, you didn't bring up coming to the blue, and you absolutely could come over to us, hit up the flight nurse game, do the critical care game, and get CRNA school too. Ironically, where I'm currently stationed at, you'd come to the school here. So you could do that for one, and hint, everybody, be on the lookout for some episodes on how to do that in the not too distant future, becoming an Air Force nurse, becoming a flight nurse, CRNA, etc. But so that's an awesome future plan. I think that's great. I want to be respectful of your time, Kevin. So Kevin, now that we're back from our little weather break, for everybody listening who won't hear this fact, it was pouring rain in San Antonio, where Kevin currently is, and his internet cut out. So we're back for round 2.
Yeah, like that was crazy. Like I'm actually really surprised you didn't hear the thunder and stuff going on, but it was thundering, and then next thing you know, boop, went off, and I'm like, wow, all right.
It's better than what I was doing, Kev. I was sitting there talking to myself literally on the screen, and then I was like, oh, he's gone.
Yeah,
got it. We're gonna have to do this again.
Yeah, for sure.
But so we touched on a lot today. You know, we went over kind of you, the man, the myth, the background. Kind of touched on the corpsman, the nurse piece. Hit up the ICU world. Definitely hit up the educating others and education side pretty hardcore. I did want to throw one thing onto that I was actually thinking about during a little weather break. Ironically, I was sitting in the gym. As I told you, I went and did some self-care in the gym. Shout out self-care. Go check out that episode, folks.
Yeah.
And one thing came to my mind as you and I had been talking about it, and it hit me in the gym. You got to be humble, approachable, and credible to be that kind of instructor. And hearing how you operate and how you were teaching, that just like, I was like, shit, that's Kevin. That's literally him. I'm like, that fits him well. So I was like, just so you know, that's how I would describe how you was an instructor and how you went about that philosophy, man. I think that was awesome. CRNA in your future, I think that's amazing. That's awesome stuff. A little bit of segue, flight nurse first, some critical care ICU time. I think that'll be cool as hell. I'll see you in the ED. I can't do ICU. Just throwing that out there. Sorry.
Can't do it. Breed, man. Takes a special breed.
Dude, I'm not the one that's gonna go tape up all your drip lines. Sorry, not happening.
Hey, look,
I'll bring them to you pretty, but it's gonna take a minute.
That was probably one of the biggest things I kind of had to accept. I'm in here trying to give sodium phos, or I'm trying to give insulin on an insulin drip, or we're starting pressors or whatever, and you see all these lines, and I'm just like, how do you guys maintain all these lines? And they were just like, oh, like we take like the popsicle stick and we put foam tape and we put it around the side, and I'm just like, what? And then awesome. They have this octopus line that has like 5 or 6 ports in it, and then they're all labeled with tape. Some will say vaso, some will say levo, then they'll say insulin, and then you can't put insulin in the back because you want insulin to go first. You got to put the lactator ringers in the back so it pushes everything through. And I'm just like, what? And so like it was just awesome. It was a lot to take in, and I always ask those questions, and I was like, hey, so what will be the purpose of doing this? And they were like, you do this because of this, and you do that because of that. And that was specifically like where I was asking about insulin, and I was like, why put insulin at the front of the port? And he was just like, because you don't want anything to be in front of insulin, obviously, because we're checking blood glucose, right? Which in the burn ICU we check every hour, because of hypermetabolic rates and all that stuff that's going on. And I mean, 1 hour you'll see somebody's blood glucose freaking like 130, and then the next hour it'll shoot up to like 210, and you're like, what the hell? So you're consistently titrating your insulin drips to to maintain that. And of course we have the sliding scale, and I think there's another one that's coming out called Endo Tool. I don't know if you guys are doing it up there, but I think it's one of those things that's being piloted here. But essentially it's an electronic paper scale that's calculated by the computer to tell you if you're titrating up and down, like if you're going to go from 12 units to 9 or vice versa, go up and down, so on and so forth. So yeah, man, it definitely takes a special breed to be in nursing, period, but then to be in those specific areas. Like you would never catch me in labor and delivery.
And neither am I.
You would never catch me.
Not a chance.
Like
you even just going to do that.
Even just going through peds and newborn and OB and stuff in nursing school. It's just like, it's one of those places where as a man you feel just uncomfortable. You're just like, I shouldn't be here. But
Nope.
you know, like being a newborn was nice, but it's just like, all right, I feel like I just shouldn't be here. Nope. Because, you know, we're in L&D, and then having somebody's husband or boyfriend or baby daddy or whoever looking at you like, why are you in here? Like that shit is too funny to me. And I'm just like, hey, I'm just here to learn.
We call this male nurse problems. This is what we call that.
That really is a male nurse problem. Like, it's just like, I can't be here. And that's why like during that portion of nursing school, I always leaned towards all the girls that were in my class. And I was like, help me understand, you know, postpartum anything or freaking, you know, everything. And they were like, oh, well, that's easy. And I'm like, yeah, it's easy for you because you popped out 2 kids. But, you know, like I said, it takes a special breed to be a nurse and special breed to be in those specialties. And like I said, specifically, ICU has just been, you know, where I've been wanting to go for the longest time, because I want the challenge. When there's things that I'm afraid of, such as, you know, the critical care aspect, CRNA, cardiovascular, neuro, burn center, I was just like, I literally say to myself, I'm just like, fuck it, let's go. Let's see how it goes. And, you know, for the most part, it works out for itself. And don't get me wrong, like when I first started in the burn center, my first 2 months there, it was just like I had the new grad blues, like really, really bad. Like I was like, man, I don't know anything.
It's a thing.
You know, it just I don't know anything about anything. That's why I'm a boot. Hence the name, the boot nurse. I'm a boot. I don't know nothing about nothing. And it's always gonna be like that. It doesn't matter what type of nurse or what type of person that you are, you're gonna consistently learn new things every day. And when I was going through all that, you know, it just sucked. And then eventually I slowly started to get it. And now, you know, I love where I'm at to the point to where I can continue to learn, you know, in all of those environments, which is why I was like, I want to go flight, and then I want to go CRNA, and I want to understand and learn, you know, all of that. So
I like it, man. So much going on. I definitely want to make sure everybody, if you're good with it, and I have a hunch you are, because that's just the kind of person you are. How could everyone get a hold of you to, you know, if they got questions, comments, concerns, want to check out some of your videos on YouTube? How can everyone get a hold of you?
First off, I don't want nobody contacting me at all. No, I'm just kidding. I'm kidding. If you need to get a hold of me, call my receptionist. I'm just kidding. My receptionist is me.
Oh, man.
Only me. But I am on all social media platforms at The Boot Nurse. Of course, if you Google it, or if you go on YouTube, or if you go on Instagram, if you go on Facebook, you'll find me. You'll see my glorious face in either my uniform or a mask that says The Boot Nurse or something. But yeah, you can find me on all those social media platforms at The Boot Nurse. And if anybody ever has any questions about anything, I am super active on Instagram. So, and if I don't get back to you, you know, just know that I see it, and I'll get back to you, you know, as soon as possible. Got a lot of things going on. Got a lot of things in the works. I might do I might do some stuff later on. Hint. So, yeah, that's where you guys can find me.
That's awesome. And I've got all those platforms linked for you, your YouTube channel, your Instagram, your email, Facebook, all of them be in the show notes linked up for you so everyone can get a hold of you.
I do
check out his videos,
request.
Guys. Which one?
I do have, check out the videos, because I got a bunch more coming. Hopefully everybody will like them. But I do actually have one more plug that I would like.
Go for it.
I got a buddy of mine who just started a YouTube channel and just started an Instagram. And he is all about the educational aspect of learning the nitty gritty about being a nurse down to the atom. And he likes to do it visually. He actually was my preceptor in the burn center. And like I said, he and I were talking about, you know, podcasts and YouTube and, you know, just visuals. And the dude is probably one of the smartest people I've ever met. And he would always walk around the burn center drawing, everything from what is the anion gap to ABG interpretations to oxygen saturation or save O2, all of that good jazz. So if everybody gets the chance, I need everybody to flood at Visual Nurse. That is the plug and the link to his Instagram. So he doesn't know that I'm doing this, but I'm giving him a huge plug because I want to see him succeed, and I want everybody to get as much knowledge as they possibly could, because I learned about ABG's interpretations from him, and I want everybody to pick up what he puts down. So at Visual Nurse on Instagram, and trust me, you'll see it. So everybody go follow him.
That's awesome. I am definitely going to go check him out. I think I was actually looking at some of that earlier today because I think you put some of it up there on yours.
I did.
That's awesome, man. Like we always said, education's key, man. You learn something new every day, and that's awesome. And just sharing that knowledge, that's just what we're all about here, what we're looking to do for everybody, big picture. All right, Kevin, you already know it's coming because you're the only person that I've had on here that I actually warned that it's coming.
Yeah.
Bottom line question, what does it mean to be a nurse?
What's funny is even though we had this conversation and I told you, like, hey, I know exactly what it is. It's just like, even though I know you're asking me again, it's just like, ooh, surprise. I guess for me, when it comes to, what does it mean to be a nurse? It's putting others before you. Being a nurse is hard. Becoming a nurse is hard. Being a nurse is just as hard, if not harder, especially after the things that have gone on, the last year with, nurses being at the forefront as well as everybody else. But we're specifically talking about nurses. But what it means to be a nurse is putting yourself or putting others before you. Being a nurse is a gift and a curse. I didn't mean for that to rhyme, but being a nurse is a gift and a curse, because it's a gift because you get to take care of other people and you get a genuine satisfaction of seeing the health and well-being of someone get better. But it's also a curse because some people don't get better. And most people are emotional creatures to the point to where, we grow attached to those patients. And some of those patients are going to leave the hospital. Some of those patients are not going to make it and they're going to pass away. Some patients come to you in just the most awfulest of ways. And, it's just one of those things that we as nurses have to kind of accept when we, go through school and when we get that license and when we start working on these floors or working wherever position that we are in. So my whole thing about what it's like or what does it mean to be a nurse is putting others before you.
I like it. Definitely couldn't have said better myself. It's
drop.
Awesome. No, mic drop, really. I definitely could have not said that better myself. And I love hearing, and I say it every time I do this, and I'll keep saying it, I love getting the answers to this question because they are all different. I have yet to get the same answer twice. I have yet to get ones that are even similar to any degree, except in the fact that they're all about taking care of people. So I think it's awesome. Kevin, the Boot Nurse Gibson, it has been so much fun, man. I appreciate you coming on. We'll definitely stay in touch. Definitely spread the word, spread the love and education. Be on the lookout for more of your stuff. And just thank you for coming, man. It's been so much fun, Hey,
no, man. I appreciate you having me, man. And like to all your audience that is listening, just know that it's your journey. You're writing it. Nobody else is writing it. You're not in competition with nobody. It doesn't matter what level of nursing that you're on. Just, go out there and be great, be happy, and, and teach others, because at some point, you're not going to be doing this anymore. So go out there and do good shit. Yeah, I said it. Go out there and do good shit.
Could have said it better. I love it, man. Well, thanks for coming, boss. I'll let you get out of here. We'll stay in touch. I appreciate you coming by, and just keep on keeping on. Appreciate it.
Man. Thanks, man. I appreciate it, bro.